Experts say poverty is a leading contributor to the spread of HIV/AIDS in Bomet County.
It is just the poverty that has made some people to look for sex way of a way of earning, and they are not using protected sex. They are not exercising the condom use, such as even the youths. They are not able to go and pick condoms. They may not even be having that money power.
It's actually hard to remove those cultures, the cultural norms, especially from our parents, because we know that in our communities, most of our parents are actually illiterate. They did not go to school.
With more than 14,000 adults and 1,119 children living with HIV/AIDS in Bomet County, the National AIDS Control Council and the county government of Bomet have now stepped up campaign against HIV/AIDS in the county.
So one of the ways, the strategies that we have is targeting prevention. And when we talk about prevention, the first and foremost, what is important is to have people know their status. Because once you know your status, you are able to determine also how you are going to live a quality life.
We usually write some messages and then we disseminate flyers to the schools, to the parasas and other places. We do also attend meetings where we have congregations, in churches and in chiefs parasas or any administrative rallies that the public may be having. We usually have time to go and tell them about how they can control themselves about AIDS.
Bomet County Health Education Officer Joseah Koech says the initiative will see all stakeholders in the anti-HIV and AIDS campaign pool resources to bolster response.
It is also hard for a parent to talk with a child about teenage pregnancies simply because of a culture. It's actually a taboo. We are not allowed. So that is actually the main barrier that's actually preventing the discussion on HIV/AIDS and teenage pregnancies.
Each unit has 10 community health volunteers. These volunteers move around the villages. They are able to identify the challenges and they can link us. They can link the community with the facility.
The cool thing is that counseling is a continuous process, and we usually help them on board to tell them that this thing, life must continue. And AIDS is a disease like any other, and they can carry on with life as usual.
The prevalence of HIV/AIDS in Bomet County stands at 3% against the national HIV prevalence rate of 4.7%. Ben Chumba, Lunchtime News.